In continuing coverage now, we are currently hours away from the deadline for the New Yorkers in the Medicaid-funded Consumer-Directed Personal Assistance Program, or CDPAP, to switch over to the state-selected administrator called a fiscal intermediary. New legal action is now hoping to garner a temporary halt on the overhaul. Rochester's Independent Living Center is joining in on a class action lawsuit set to be heard before a federal judge in New York City tomorrow afternoon, and the concerns are expansive.
So we're going to court tomorrow in New York City to fight for Medicaid beneficiaries whose services are being terminated without notice or due process by the state of New York.
The 11th hour is upon participants and their aid workers, part of the Medicaid-funded Consumer-Directed Personal Assistance Program, also known as CDPAP. State leaders with the Department of Health said last week, as of April 1st, the only fiscal intermediary which will be paying out aid workers is the state-selected Public Partnerships LLC, or PPL. This down from the hundreds of FIs the multi-billion-dollar program previously had structured. But the rollout to try and get hundreds of thousands of participants switched over has been less than stable. DOH Commissioner James McDonald recently announced a grace period of 30 days to be granted to aid workers who transition after April 1st, with pay promised retroactively. Rochester's Independent Living Centers signing on to a class action lawsuit on behalf of Medicaid recipients, claiming this violates their rights under both Medicaid law and the 14th Amendment for due process.
So we're going to a federal judge, to say the state is violating their rights under the Medicaid law and the 14th Amendment. They had a right to notice and due process. So we're hoping to get a temporary restraining order that'll allow people to continue to get services, because if they don't get services, really bad things happen to them. They basically can get sick and die.
Darling and Lupo both tell me fallout of folks receiving CDPAP services in the event their aid support is not able to continue working after the imminent deadline would default to visits to the emergency room and hospitals already strained with high demand.
We have serious questions about this grace period. If a worker is injured during the period they're volunteering, are they entitled to workers' comp? What happens if when they transition, they've been eligible for paid family leave? Does the clock restart, or does their work history carry with them? They're very practical questions that have not been answered.
And in the most recent notice regarding the CDPAP transition process from the State Department of Health on Thursday, the agency broadly approximates 245,000 consumers are taking action in some capacity ahead of the April 1st deadline. The court case is set to be heard tomorrow late afternoon.